Hello, my name is Jacqueline Alvarez, and I read the article Decreasing 30-Day Readmission Rates in Patients with Heart Failure. The stated goals and purpose of the research study is to decrease readmission patients' rates with heart failure by implementing an evidence-based self-care program, to develop a structured HF program and self-care program that includes multidisciplinary collaboration, patient education, and improved discharge planning, to access and impact the HF program and patient adherence to medication, follow-up care, and lifestyle modifications, to identify and address barriers to self-care and adherence, including low health literacy, socioeconomic factors, and access to healthcare resources, to improve transitions of care by ensuring post-discharge follow-ups, nurse-led interventions, and coordinations between healthcare providers. So just between the discharging physician and the cardiologist. Or like the primary. Summary of the major themes of the relevant supporting literature cited in the research article. So kind of like a brief background. HF affects 6.2 million adults in the U.S., approximately a national cost of $30.7 billion annually. Readmission rates of HF are high, within 21% of patients readmitted within 30 days, and nearly 50% within 6 months. Socioeconomic disciplinaries impact HF outcomes, with Black patients having 1.5 times higher risks due to factors like hypertension, diabetes, and limited healthcare access. Adherence to medications, diet such as reduced salt intake, eating heart-healthy foods, and limiting fluid intake. Some lifestyle changes like diet adjustments, regular physical activity, weight management, smoking cessation, limiting alcohol, monitoring just like social symptoms, managing stress, adhering medications, sleeping habits is a key barrier to reducing readmissions. Low health literacy and lack of patient education contribute to poor self-care and high hospital readmission rates. Many hospitals lack standardized HF care, leading to inconsistent care transitions. Studies indicate that early follow-up care within 7 days with a cardiologist significantly reduces readmission rates. Multidisciplinary care models involve nurses, case managers, cardiologists, and this improves patient outcomes. The teach-back method is where patients repeat key information, has been shown to improve patient understanding and self-care. Medication adherence is very important. Some of this can be providing meds at discharge, taking medications at the right time, following the dosage instructions, using reminders on your phone, refilling prescriptions on time, reporting side effects to the physician, adhering to dietary restrictions. Help prevent HF exacerbations. Socioeconomic factors such as lack of access to affordable, healthy foods and financial constraints are major contributors to poor HF outcomes. Why is it necessary or important to conduct the current research? So, like I already stated, a lot of patients get readmitted into the hospital after already being discharged within 30 days. About 21% nationally will be back in the hospital. Frequent readmissions contribute to worse patient outcomes, increasing healthcare costs and hospital penalties under the Hospital Readmission Reduction Program. So hospitals don't want to see patients back over and over. I'm not saying they don't want to provide care, there's other methods to prevent critical patients into coming in if they can be prevented. The study institution did not concisely follow American AHA guidelines for the HF management. So it kind of like there's no structured program ensuring that patients receive education, follow-up, and medication adherence program. Patients in the study population face low health literacy, financial hardship, and poor access to healthy food choices. But that's kind of where these patients need to be educated in programs such as like Meals on Wheels that can come and give them healthy options. But Meals on Wheels is only like Monday through Friday. So these factors contributed to non-adherence to the diet, medications, and follow-up care, increasing the risk of readmission. And some of these folks can't even afford their medications. Some of these medications that they need in order to not get readmitted to the hospital, they can't afford. Prior studies indicate that multidisciplinary care, early follow-up, and structured patient education can significantly reduce the admission on rates. Implementing these strategies in real-world hospital settings could provide a model for improving HF outcomes in high-risk populations. Many HF experience gaps in care after discharge, leading to missed appointments, poor symptoms recognition, and preventable hospitalizations. The study aimed to improve post-discharge care through structured follow-ups, nurse-led interventions, and enhanced patient education. So research design is pre- and post-op intervention. So just before they get admitted and pre-discharge and post-discharge. The total number of patients was 47. And they were between the ages of 48 to 90 years old. 26 patients were male and 21 patients were female. 79% were black, 19% were Hispanic, and 2% were white. Procedure used to obtain the data. Patients received education on their disease process, medications, diet, exercise, and early symptoms recognition. So they were just kind of shown some of the symptoms that they could exhibit to kind of like look out for at home once they were discharged. Then patients received a phone call 48 to 72 hours after discharge, just to kind of check in and to see if they had any questions. Patients were then scheduled with a cardiologist visit within 7 days post-discharge. So to make sure that they were seen by a physician after being released from the hospital. Materials and measurement devices for data collection. The teach-back method was used for patient education just so they could, again, reinstate those key facts that they needed to know before going home. And the study tracked medication adherence, lifestyle modifications, and follow-up appointments. The step-by-step description. The study was conducted over a designated period with structured implementation phases. Multidisciplinary teams included the nurse educators, case managers, cardiologists, and hospital staff. Patients were given educational materials, including booklets and medication schedules, and a follow-up system ensured post-discharge engagement. Procedures used for data analysis. So data analysis, they use the SPSS, which is the statistic package for the social sciences. The readmission rates and adherence rates were compared pre- and post-intervention. And the findings. The 30-day readmission rate decreased by 16.6 from 28.6 to 12%. And patients who followed up with the cardiologist had improved adherence to treatment. Medication adherence significantly improved. And the researchers' conclusion. The evidence-based heart failure program improved knowledge, early symptom recognition, lifestyle modification and adherence, and the multidisciplinary team approach to reduce gaps in care, improved coordination, and transition of the care. My personal thoughts about the importance and implication of the results. The structure of the HF program can serve as a model for hospitals seeking to reduce readmissions. The nurse-led interventions and patient education are critical components for success. And research weakness potentials that could affect the results. So the study was only conducted in a single institution, and there was only 47 patients. So it was a very limited population. Social economic factors were affecting the patients outside of the hospital environment. So it was in a big city. So socioeconomically, it wasn't affected, kind of like in the Dumas population. And then self-reported adherence may introduce bias. So some of the patients can say, like, yes, I am taking my medication like I'm supposed to, but you're just kind of taking word of mouth, so to say. I know that the Dumas Hospital kind of has some of these in places with the telenursing during COVID and such. We kind of follow up with our patients and do the telecom to make sure that we lower our status with readmissions. Thank you.